is task 15, physical exam of a dog. So I have my dog here in the background being handled by my assistant, so we're just going to observe him from a distance. So we're looking at his general well-being and his attitude. So as you can see, he's very bright and alert. He's attentive. It's a nice, friendly, small dog. You can see he looks nice and healthy. His hair coat is in good condition. He has a nice posture. Can't see any signs of lameness there while he's moving around. He seems to be moving around nice and easily with no sign of any discomfort or pain. We can see he's in a good bodily condition. You can see his waistline. So we will probably give him a body condition score of around 6 or 7. We're going to go ahead and pop him on the exam table and commence our physical exam. So as part of our physical exam, it's important to have a weight on our patient. So because Benji is a small dog, we've got our baby scales here, which will help us get an accurate weight. So I'm just going to go ahead and turn those on. Okay, and if we can just place Benji on the scales. Oh boy, nice and still, buddy. Okay, so just waiting for that to register. So Benji is 22 pounds and 3 ounces. So I'm going to just record that in his chart, and then we'll begin our physical exam. So now we have our dog on our table. We're going to commence the physical exam. So we're going to start at the dog's head, working all the way over his body, looking at all his bodily systems. So to start off with, we are going to just get his vital signs. We're going to get his heart rate, his respiration rate, and his temperature. So I'm going to start with his heart rate. We're going to listen to his heart for 15 seconds, multiply that by 4, and that will give us our heart rate for beats per minute. So go ahead, just place my stethoscope over his heart. You can hear a nice strong heartbeat there, and we're just going to time that for 15 seconds. Okay, so listening to his heart for 15 seconds there, we actually counted 15 beats. So I'm going to multiply that by 4, which gives us a heart rate of 60. So that's within the normal range of heart rate for dogs, which is between 60 and 160. And then while we're listening to the heart, we're also going to feel that femoral pulse, make sure we don't have a pulse deficit, and we can feel 1 pulse for every beat of the heart. So go ahead, just replace my stethoscope on his heart, and then feel his femoral pulse just up on the inside of his hind leg. And we've got a good strong pulse, and I can feel 1 pulse for every heart rate there. Okay. And then we're going to go ahead and get his respiratory rate. So we're just going to watch him just for a few seconds. We can see that he's breathing in a nice regular pattern. We've got no excessive panting or raggedy breaths. Can watch his thorax or his abdomen there just move up and down as he's breathing in and out. So again, I'm going to just calculate and count for 15 seconds and calculate that times by 4. Okay, so 15 seconds, we got 5 breaths, so we're going to times that by 4, which is 20, which is again within our respiratory normal respiratory rate for dogs. And then finally, I'm just going to go ahead and take his temperature. So we're going to use our I've got our lube and our thermometer here. So just going to go ahead and place a protective cover on the temperature probe. My assistant's just going to restrain him for me so he's nice and still. We're going to go ahead and just insert that thermometer into his rectum, and then we're just going to wait for that to record a temperature. Normal dog temperatures between around 100 degrees Fahrenheit and 102.2 degrees Fahrenheit. Any higher temperature may be indicative of a fever, which may be indicative of an infection or an inflammatory response. And anything that's very high also may indicate the onset of heat stroke. Benji's temperature was 101.8, so we know that's well within normal limits. I'm going to go ahead and record his TPR on his record here. And now we have his vital signs. We're going to go ahead and begin our head to toe exam. So we're going to start with his head. Hey, buddy. And we're looking to make sure that everything on his face is nice and healthy. We're making sure we could no visible swellings or lumps. We're going to check his ears. We're looking for any indication of discharge, any redness. Also, sometimes we can find external parasites on the ears. We may see some evidence of ear mites, but both of Benji's ears look good and clear. There's no evidence of discharge there. They don't smell. They're not red. So moving down, we're going to look at his eyes. He does have a little bit of tear staining. It's quite common in these white coloured dogs, but his eyes look good. They're nice and clear. There's no redness or anything abnormal. And then looking at his nose, there's no discharge. Both his nostrils are the same size and symmetrical, and we can feel his breath on both sides, so we know we don't have an obstruction on one of those nostrils. And then I'm going to go ahead and check his mucous membrane colour and his capillary refill. So we're going to do this by just lifting his upper lip. So he's got some pigmentation there on his mucous membranes, but they're nice and pink. I'm going to test the capillary refill. Just going to press on the gum until they go white. Remove the finger and they've returned to pink within the 2 seconds, so we know he's got good perfusion there. While we're looking at his mouth, we're also going to make sure, oh boy, that his teeth are in good condition. We have got a little bit of dental tartar there, but his gums don't look red and they don't look inflamed. If he's going to let me, I'm just going to open his mouth. I'm just looking at his tongue, his hard palate and his soft palate. Good boy. Can't see any evidence there of any masses or any lesions, so he looks nice and healthy. We're going to go ahead and just palpate his lymph nodes just behind his jaw, and they feel good. They're not swollen or enlarged. I'm going to feel his, good boy, trachea. Make sure he's got no cough response. He doesn't have a collapsing trachea, so he looks good. And then we're going to go ahead and move on. We're checking his neck. We're looking for any pain along his spine. He doesn't seem to have any. He's got a good range, oh boy, of movement there in his neck. He doesn't seem to be sore lifting his head or putting it down. We're going to palpate those prescapular lymph nodes, which are just in front of his shoulder blades there, and that feels good. He's not enlarged or swollen. They feel nice and symmetrical. And moving on to his back, we're checking for any back pain by just gently palpating his spine all the way along. If he had any pain, we would be able to see a flinch reflex there, which we don't. Also, while we're checking the back, it's a good opportunity to check for any external parasites. We can quite often see fleas around the base of the tail. Also checking for ticks or any other lumps and bumps that shouldn't be there, but Benji looks good. We can't see any parasites. I can't feel any lumps or bumps on him at all. So then moving to his chest, we're going to go back and listen to his heart again. We're going to check all the points of maximum intensity. These are listening over the heart valves and good areas to hear any murmurs should there be any. On the left side we've got the mitral valve, the pulmonic valve and the aortic valve, and on this right side we have the tricuspid valve. So I'm just going to go ahead and auscultate all of those areas, make sure we don't have any arrhythmias or any murmurs. So starting on the right side, I'm going to listen to that tricuspid valve. That sounds good. Can't hear anything abnormal. And then if my assistant could just turn him the other way, we're just going to listen on the other side. So start with the mitral valve, and then up and back, working in a triangle shape to hear all those points of maximum intensity. And his heart sounds good. Can't hear any evidence of any murmurs. So while we're listening to his chest, we're going to go back again and listen to his lungs. So we're going to check his lung fields. We're listening for any evidence of wheezing or crackling or any kind of abnormal noises that shouldn't be there that may indicate a problem with his lungs. Oh boy. it's important to listen over the chest to make sure we've listened to the whole lung field, and that we can only hear normal breath sounds and nothing that shouldn't be there. Okay, so Benji's lungs sound nice and healthy. So we can go back now and palpate his abdomen. We're feeling his internal organs. We shouldn't be able to feel too much on his abdomen palpation. If he's nice and healthy, which we think he is, we shouldn't feel anything at all. We may be able to just feel the bladder if it's full, and maybe a colon if there's some feces in there. But we're trying to feel any abnormalities or enlargement with the kidneys or the liver up in there. But he feels good. I can't feel anything at all. And while I've got him facing me the right way, we're going to lift up his tail. We're looking at his rectum and also his back area, and make sure we've got no swelling, no masses. We're also looking for any evidence of fecal staining, which may be indicative of diarrhea, but he looks nice and good. We don't have anything there. And then we're just going to check his penis. He is a neutered male, so we don't have any testicles, but his penis looks good. It's maybe a little bit dirty, but not too bad. You can't see any obvious discharge. There's no pus, no yellow or green discharge there, so that looks nice and healthy. And then moving on to his legs, we're going to just feel down both those hind legs, make sure they feel nice and symmetrical, no evidence of swelling or any masses or any soreness. I'm going to check those paw pads. Good boy. Make sure we don't have anything sticking in them, no lacerations. We're just checking those nails and make sure that they're a nice length, none of them are broken or ingrowing. So we're just going to go ahead and check all 4 feet. And then while we're lifting up the legs, we can also check range of movement, make sure he's nice and mobile with no signs of pain. Good boy. And that's good. And then those front legs. There, his nails look good. He does have a little bit of pink staining on his feet, which may mean that he's licking those a little bit. Could be an early sign of some allergies, maybe to the environment or to some food. Just check your range of movement there, Benji. There you go, good boy. And then onto this other front leg. So making sure those nails aren't ingrowing, they're not broken. Again, a little bit of pink staining there, so that will be something that we'll record and report to the vet in charge of this case. And then just a final check of range of movement. Good boy. Okay. So overall, Benji looks good. Can't find any obvious signs of ill health. He doesn't have any abnormal lumps and bumps. His heart and lungs sound good. We do have just a little bit of dental tartar on the teeth, and that's staining on the feet, which we will record in his chart and report to the vet in charge of the case.